Hey everybody, Dr. Scott Keller again, here to show you a little bit more with hip mobility. One of the more common injuries that we see or problems in the front of the hip, other than just being tight, as we talked about last time, tight hip flexors contributing to this anterior tilt in the pelvis, a lot of loads in the lumbar spine, is something we call femoral acetabular impingement syndrome. And basically that's a fancy way to say there's a pinch in the front of your hips. You might have groin pain, deep hip pain, especially on internal rotation movements of the femur, okay? So once again, when we're tight in the front of our hips, it can kind of contribute to that. A lot of compressive loads in that ball and socket hip joint. The hip joint is a ball and socket joint, and so basically any ball and socket joint in our body, which the hip and the shoulder are really the only two, it basically requires a ton of mobility. We should be able to move these joints in basically 360 degrees of motion in any direction. With that pinching or tightness in the front of the hip, obviously it limits the range of motion in the front of my hip, and it can cause a lot of pain and discomfort in certain movements. So what we're going to do is a version of what's called the frog stretch, as a lot of people know it as. Now, one of the muscle groups that gets really tight in a lot of us, other than the iliopsoas and the rectus femoris that we talked about last time, is actually the adductor group. So kind of these big muscles on the inside of your thigh or your groin there. One of them specifically is called the adductor magnus muscle. Now it's an interesting muscle because a lot of us, when we squat, and I'm going to show you an example here, when we get down to 90 degrees or below, okay, instead of being able to maintain this neutral spine kind of through my lumbar area, if you watch people or maybe concentrate on this on yourself, we kind of have this flexion of our pelvis and of our lower back, which leads to a ton of loading on our discs and our lower back, setting you up for injury. Some people call this the butt wink at the bottom of a squat, and this is what it looks like. Basically, you descend, you're fine, you're fine, you're fine, and then all of a sudden, you crash into this flexion in the lower back. So it doesn't usually happen until you get to almost 90 degrees or below. Once again, super hard on the lower back. One of the things that can contribute to that, once again, this is by no means the only thing that can contribute to that or cause that, but the adductor magnus muscle attaches on the underside of your pelvis here, and it attaches on the inside of your femur. Now what it does, when it's tight, okay, and overactive on the inside of your thigh, when your pelvis, when you start descending, it is going to pull that pelvis under like this, because it just doesn't have quite enough lengthening range of motion. As you get down further and further, it's supposed to be lengthening, and then it just can't go any further because it's so tight, so it literally pulls your pelvis forward, causing your lumbar spine to flex, okay? So the frog stretch is going to address the adductor magnus muscle specifically, okay? So the frog stretch, the version I'm going to show you, knees about as wide apart as you can get them comfortably, and I would put an ab mat or something underneath your knees if you want to be a little more comfortable. It can hurt the knees a little bit here. Now I'm going to make sure my legs are angled back, so my feet and my heels are basically right underneath of my glutes, my butt cheeks, okay? I've seen this stretch before where people do this kind of motion, okay? Now the problem with this motion or this angle of the leg is that's actually internally rotating the femur, causing impingement in the hip. So if you deal with this problem, this is the last position you want to put your hip in, because you're internally rotating it, pinching the cartilage and some of those structures on the hip. So we want to do the opposite of that, where we put the foot under the butt, which is externally rotating the hip or the ball and socket joint, which is going to be a lot more comfortable and more beneficial for you. So once again, I would stay away from this position here. That's really, really hard on the hips. So we're going to get in this position. I'm going to support myself with my hands on the floor, and I'm just going to sit back as far as I can. Once again, don't push it if you can't reach your heels, but basically the goal is here to get your glutes to touch your heels, okay? And once again, just like the hip flexor stretches I showed you last time, I prefer dynamic stretches. I'm going to sit back as far as I can, hold for 2 or 3 seconds, and then I'm going to come up and rest a little bit out of that, and then repeat that about 10 times nice and slow and controlled, all right? One thing that you might feel, if you feel like you can sit all the way back and you have no problem, you don't even feel a stretch in your groin area, push up with your hands until you're in a more upright position, Okay, and almost kind of tilt that pelvis forward a little bit, just slightly, not to hyperextend your back completely, but a little bit of a tilt forward in that pelvis. You should start feeling it right here in your adductor group, okay? And then relax and sit up tall, chest up, chest out, feeling that stretch right there, okay? You can isolate right versus left by walking your hands to straddle the knee. Once again, sit back, chest up, chest out, feel that stretch in the groin, and then relax out of it. And repeat that one on the left up to 10 times, and then repeat it as you rotate to the right. Okay? I'm going to show you just a quick angle from behind so you can kind of visualize where my feet are at. So this is what it would look like from the posterior side. There. Okay, so retest of this would obviously be just an air squat feeling. If you flex forward at the bottom of the squat, you go through this stretch and you may be able to maintain a better position afterwards, all right? So work on this one, give it a shot, see how it goes.